7:44 back here on the Tuesday edition of Breakfast Television, and there's been much talk about measles given a recent outbreak here in Vancouver. Joining us, Monica Naus from the BC Centre for Disease and Control. First things first, what do we know about the outbreak, confirmed cases, and who is most at risk right now, Monica?
Well, the outbreak is confined to the schools that Vancouver Coastal have informed. So parents' letters have gone home in those 3 schools, and I believe the latest number of cases is still 8.
What's the biggest risk factor right now? Parents, kids out there thinking they want to avoid this altogether, what do they need to consider?
Well, if you're a case of measles, you've been informed about that and you're probably staying home. I think that all children in those schools have been put on alert about the signs and symptoms of measles and the advice to stay home and then to seek medical attention outside of a busy waiting room, to call ahead before you go in to be seen. So there's still a possibility that there'll be new cases springing up in those schools, children who've been exposed. The incubation period for measles is up to 21 days, even though most people will have illness within 10 to 12 days of exposure. So at this point, it really is a localized outbreak confined to children attending those schools, and children throughout the province and throughout the city are not at risk.
And what are some of the symptoms if you think something's going the way of measles?
Yeah, so measles starts off with cold-like symptoms, so coughing, red eyes, and then a fever. And then after that, a rash breaks out. The rash usually starts on the face and the neck, and then it spreads all over the body. And it's usually not until the rash breaks out that it's clear that it's measles. But if you've been exposed to measles, you should be watching for those early symptoms.
If you get vaccinated, is it a guarantee you're not going to get the measles? How effective is it?
The vaccine, 2 doses of the vaccine is about 99% effective against measles. So it's not a guarantee, but it's pretty good.
And for scheduling, especially for parents looking out for their kids, when is the earliest children can start to get the vaccination and then the follow-ups?
Routine vaccination is on the first birthday. It doesn't have to be on the first birthday, but that's the recommended first dose age. And then the second dose is given at school entry, usually 4 or 5 years of age, just when kids are entering kindergarten.
And for adults, and I was asking you this during the break, if you're not sure when you got the vaccination done, how do you access records? Do you need a booster for this to keep this alive?
You don't need a booster dose. If you've been vaccinated in the past, and if you're born in 1970 and later, 2 doses of measles-containing vaccine are recommended. People who were born earlier are likely to have wild-type measles, the real McCoy. For example, I had measles. I was born in the late 50s and I had measles. But if you're not sure whether you've been vaccinated, your healthcare provider may have your record on file, or your local health unit. Especially if you're a younger individual, there's an excellent chance that your local health unit still has your immunization record on file.
So we get that information, and then the other question some parents can ask is the idea of safety surrounding the vaccinations. What's the most common concern you hear about vaccinations, and what is important to consider with getting these done?
Well, in the surveys that we've done in British Columbia of parents who've chosen not to vaccinate their children, the most common concern about vaccines is safety, vaccine safety. But the truth is that the vast majority of reactions to vaccines, or side effects as they're called, are redness, pain, and swelling at the injection site. A very small number of children will have any other type of side effect, and most of those are transient. You know, kids are better in 2 or 3 days. With measles vaccine, the most common, I guess, serious side effect is a fever, and that happens about 7 to 12 days out from vaccination. Very uncommonly, children will have a seizure associated with that fever, and that happens to children who are more likely to have seizures when they get fever from any cause, including a common viral infection.
And I guess overall, the seriousness of the condition when we're dealing with measles, how does it attack the body if it is not treated long term?
Measles?
Yeah.
Well, there's no treatment for measles. Measles is a viral infection. There's no specific treatment. So people who get sick with measles get supportive care. If they're dehydrated, if they're vomiting, if they have diarrhea, which can occur, then they need intravenous fluids. If they have a pneumonia, it's supportive care. They could potentially need a ventilator or oxygen until they recover from that themselves. So the best way to treat measles, that's actually to prevent measles, because there's no specific treatment for it.
Okay. Well, resources for the preventative measures, a couple that you'd recommend?
Our website for the public is immunizebc.ca, and our website for healthcare providers, but also emerging measles information, is bccdc.ca.
Prevention is the name of the game. Monica, I appreciate you coming on to share this message.
You're welcome.
All right, we'll take a break. Watch this.